One of the most common things we hear from patients is they feel pressure right there at the back of the head. They feel like their head's too heavy for their neck. They get chronic headaches there. Oftentimes, they'll get shooting pain up the back of the head. And these people generally are taking muscle relaxers and painkillers, and sometimes they do physical therapy or massage, but the pain and the tightness and the heaviness just doesn't go away. And the reason it doesn't go away is those muscles, those groups of muscles right there are called the suboccipitaal muscles, which attach to the back part of the skull, the first cervical vertebra, and the projection part of the C2, which is called the spinous process. And when those muscles are chronically in spasm, they cause all those symptoms that I was just talking about. So the question is, why are those muscles chronically tight? What we find is when one of the joints in the upper cervical spine has misaligned from a trauma, whether that's a car accident, a sports injury, a slip and fall. When there's a blunt trauma, it damages the soft tissue around the joint. And when the soft tissue is damaged, the joint doesn't move the way it's supposed to, and those muscles, when you lose joint motion, especially at the base of the skull, those muscles go into spasm, and they can entrap nerves that travel out the back of the head, and they can just cause that persistent, terrible, heavy feeling that people feel at the back of their neck. So the question is, how do you fix it? You get to an upper cervical chiropractor who's trained at taking 3D imaging to look at how that top vertebra has structurally shifted off the floor of the skull. And once the imaging is taken that tells us how the vertebra is misaligned, a very precise force is introduced in it to restore motion. And when the joint is restored back into its normal biomechanical range and the soft tissue starts to mend and repair, these muscles start to unwind, and that terrible full feeling and that pressure that they feel at the back of the head and the sharp shooting pain they feel up the back of the head and the headaches they're having, generally speaking, over time starts to resolve. So if you're dealing with these types of problems, leave a comment in the comment section below. We'll find you a doctor in your area that can help. And we hope this video has reached lots of people out there who have been kind of let down by the mainstream system, and they're still suffering with these sorts of problems. So hope this video has helped.